We're here. We made it. What's up, everybody? I hope you're doing well. Today, we are going to talk about one of my favorite clinical tools to use in therapy, metaphor. This is one of those tools that I use so often that I almost don't even notice that I'm using it. And so it seems worth kind of putting a little spotlight on it and saying, well, what is that thing? Is there any therapeutic value there? How do we implement it? What use does it serve? And just share some of those things with you. Before we dive into it, I'd like to make sure I give the disclaimer. I'm not an expert on using metaphors as a clinical tool, and this episode is not specifically about the theoretical approach called metaphor therapy. I don't even have training in that particular approach. So we're talking about something different today. Just make sure you hear that disclaimer. Just think of it like we're sitting in consult group together and I'm kind of casually sharing how I implement some of these tools in my practice. I find it helpful personally to have a little bit of that balance of like, I want to hear from the expert on stuff, to hear like the nitty gritty expertise stuff. But I also want to hear how some of these clinical tools play out in everyday practice for like, the regular user, the lay user, the non-expert user. So think of me in that position and not the expert position. Rather than giving a giant preface on why I use metaphors so much and why I think they're great to talk about as a clinical tool, I think it's going to be one of those things that gets illuminated clearly as I talk about how I implement it in my practice. So before I just dive into how I implement it, I'll share a quote from a video by the Milton H. Erickson Foundation on metaphors in therapy. Quote, "Metaphor is a figure of speech in which a word or a phrase is applied to an object that is not literally applicable." And metaphors in therapy can be counselor generated or they can be client generated. And you'll see for me personally in my practice, most of my uses for metaphor in therapy are therapist generated, or they might be collaborated on and created together with the client. However, there are specific types of therapies that are emphasizing client-generated metaphors like metaphor therapy, and that's an area that I'm not especially trained in. And overall, I'm going to break down this episode into two larger parts. The first part is the reasons why I might utilize metaphors in therapy. And the second part is all about different types of metaphors that I might utilize in these moments. So let's dive into the first part where I just share the reasons why I like to use metaphors in therapy. Like when is a good instance for me to say, let me pull in a metaphor if I can. One big category that I will often use metaphors for is helping a client grasp a new concept or helping a client get buy-in on a concept. So an example of using metaphor to try to help a client grasp a new concept might look like if, let's say, I'm wanting to explain parts work from an internal family systems framework, and the client is not so familiar with that concept, then I might use a metaphor like, it's kind of like if part of you really wants to eat that junk food because it's going to make you feel good right now, but another part of you knows it's probably a good idea to eat some healthy vegetables instead because that's going to make you feel good long term. Both parts of you are at play at the same time, even though you're just one person. And let's say instead I'm trying to get buy-in from a client, then I might use a metaphor that is pretty easy to grasp to explain the scenario I'm inviting a client into. So let's say I'm doing systematic desensitization with a client to help them overcome panic disorder. Then in order to describe it, I might explain it like, well, if you were to imagine somebody had a phobia of flying on airplanes, rather than just throwing them on an airplane and saying, good luck, we might spend a moment, remembering times in the past when you flew on an airplane or looking at pictures of an airplane and then finding more and more spaces to engage with airplanes before we actually get on an airplane and fly. And eventually, we would expect that definitely at some point you are going to get on that airplane and you are going to fly, but it's not step one. We're going to build up to it slowly. That's an example. That's literally just explaining systematic desensitization with a pretty concrete phobia, but generally, when I explain that concept, if we're applying it to something that maybe feels a little bit more abstract in the way that someone's panic disorder is presenting, then it's a lot easier for people to get buy-in. Like, oh yeah, that makes sense that you would do it that way. Another reason why I would use metaphor is to help a client feel seen and validated. I think demonstrating that we see and can validate what a client is going through is something that we really can't overdo, but especially if a client feels like they're either having trouble describing some aspects of their experience or finding the words, or if they're feeling frustrated that maybe they think I'm not getting it or not quite seeing it, then I will start to pull in metaphors. I might say something like, I can see that this is kind of a tricky thing to describe, and I'm wondering, is what you're saying kind of similar to, and then fill in the blank. I tend to phrase it like, what you're saying sounds kind of like, or reminds me a bit of, or I'm curious, is what you're describing similar to? And then I'll describe some symbolic example, metaphor, and then check in to see like, am I seeing this correctly? And if you get it right, the metaphor has a way of just capturing, usually in a pretty short story, how a client is feeling and that you get what that feels like without necessarily always having all the words to articulate, here's the list of emotions and here's physiologically what's happening and here's all the thoughts that go with it. It's like, oh, it's kind of like that scene from that movie where so-and-so is caught in this dilemma. And then the client goes, oh, yeah, that's exactly what it's like. Or, actually, it's not quite like that. Then we can work with the metaphor and say, oh, okay, if you would tweak that metaphor to make it more accurate to your experience, like what would you change about it? Or can you think of a different metaphor that captures it better? Another reason why I would use metaphor with a client is to help them access self-compassion. We can judge ourselves for whatever we might be thinking or feeling or choices that we made. Maybe we have some bad habits that we're ashamed of. We can judge ourselves for any number of reasons or be hard on ourselves. And so when I can, I like to pull in metaphor as a way to help a client see themselves in their own situation like how I see them in their situation. Because they might be in a position of saying like, I'm an awful, horrible, terrible person for doing this or thinking this way or feeling this way, whatever their judgment statements are about themselves. And then I might use a metaphor to say, well, as you just told me that story, the way I felt as you told me that story reminds me of or looks like, and then I'll use some sort of symbolic metaphorical language to say, this is what it's like for me. And if it's a image or a metaphor that they can understand from an outside point of view, then it helps invite them into my shoes and see themselves with a more compassionate lens, like kind of allowing them to see themselves the way I see them. Another context where I like to use metaphor in therapy is if, for whatever reason, a topic is difficult to put words to, whether the topic is overly triggering from a traumatic point of view, and so it's difficult to talk about it literally, or maybe it's impossible to talk about it literally, or maybe, it triggers panic attacks to talk about it literally, or it might just be like this person may not have kind of full literacy in kind of emotional terms or kind of even a full grasp of everything that's going on inside of them, right? They might start using language like, I'm feeling all kinds of mixed up inside and it's hard to really explain, or maybe it's just I feel overwhelmed or, overstimulated. Then I find it helpful to see if there's some kind of metaphor we can speak within instead. For some clients, we will utilize exclusively metaphor as a tool for therapy, especially if we are working through things that are highly triggering, highly activating. If it's like what you're going through really feels similar to this event that played out in, let's say, a movie, then I might ask questions around the characters in that movie and the events of the movie. And what do you think it felt like for that person when they went through that hardship in the movie? Was your experience with your trauma similar to that? Or did it look different? How did it look different? Which character did you feel most like? If we kind of leverage some sort of metaphor, rather than talking about the client's direct experience, a lot of times it allows them an ability to communicate and even just access within themselves an understanding of their own experience. And then we can actually work with it and do things with the metaphor. The interventions happen in metaphor and symbols, and then they can start to generalize them over to their own experiences. Another case where I like to use metaphor, if I can, is if I think I might be perceiving what a client is describing in one way, but I'm also kind of second guessing, like, did I misunderstand what they're describing? Sometimes I'll pitch a metaphor in those situations to say, I'm wondering, is what you're describing kind of like this? And I'll share a metaphor and a symbol, an image. And then as I say it, I will say, would you modify anything about that? Like, am I catching the gist of what you're describing, or am I kind of off base? Is it maybe more like that? And then naming a different metaphor to compare it. Especially if a client may not have all the language to describe what they're describing, then I can kind of give them symbols and let them say, well, is it more like symbol number 1 or symbol number 2? Or if it's not like either of them, okay, here's symbol number 3. Or what would you change about the details of these metaphors to make it represent your experience more accurately? Another case where I love to use metaphor when I can is to foster motivation in my clients. And if the metaphor can be pulling from one of their own life experiences directly, all the better. For example, if I have a client who is an athlete, or maybe used to be an athlete and maybe was very successful in their athletic pursuits, and now we're in therapy and we're working on something and it's emotionally really tough, and maybe they're having difficulty finding a sense of like, I can do this uncomfortable or difficult thing, then I might reference their own history as an athlete to pull a sense of motivation. I'll say something like, I wonder, was there ever a time when you were training to run that marathon? I reference marathons in these videos a lot. Sorry. But if I say, hey, well, I remember you said that you run marathons, and I know that can't be easy at all to train for, and it takes a lot of dedication and has to be challenging at times. I'm wondering if there's anything we can pull from how you approach the challenging or uncomfortable moments when it comes to training for a marathon that we can then apply here. Because the easiest way to motivate somebody is to borrow from their existing energy rather than trying to like coax them into a different state of mind. So like, can we get them back into that marathon training state of mind and then borrow that or carry it over, generalize it over to this current situation? And of course, I think the most talked about category of like why we would use a metaphor is as a mindfulness practice. Most of us are familiar with how metaphors show up in mindfulness practices. For example, like the leaves on a stream practice, where you imagine your thoughts or your worries kind of getting set down on a leaf as it floats down the stream, and then you can watch it kind of continue to float away. That's a metaphor. So using imagery, symbols, imagination to kind of lean into psychological concepts is quite valuable and definitely is helpful as a mindfulness practice, because it allows us to kind of hold the metaphorical image in our mind and let that be the thing that we focus on as our mindfulness practice. Okay, so I think there are a lot more ways someone could use metaphors in therapy, but as I just sat down and brainstormed how I tend to use them, this was the list that came to mind, but feel free to add to that list in the comments below if there's other ways you use metaphors in therapy. But now we're going to jump into part 2 of this episode, where we're going to talk about types of metaphors. I think metaphors is one of those things where we're like, what does that even mean? And then I get confused because I'm like, is it a metaphor? Is it an analogy? Is it a simile? I don't know. I'm just using all of those words interchangeably, which I know is incorrect, but this is how, listen, I get confused. Any symbolic language to describe what somebody is going through or a concept or describe something else, that's what I mean when I say metaphor. But sometimes it can be so like floofy that we're like, well, what is a metaphor? So, but there really are kind of types of metaphors, ways that they can kind of present. So let's break them down a little bit. The easiest access metaphor to me is any examples that exist within a client's life or their own story. I referenced this one earlier, right? Like if the client is an athlete, you can reference a metaphor for all their athletic pursuits and carry them over into whatever content you're talking about now. That could serve as a motivator, but it could also help clarify things. So let's say, for example, you're working with a couple and one of the parties that you're working with says like, "Doc, therapy's taking a long time. When do we like feel all the way better? When are we done?" I empathize with that feeling. Then let's say if that person has completed graduate school before and has a graduate level degree or undergrad for that matter, then, we could point to that and say, it might feel a little bit like, your graduate training or your undergraduate training where you turn in one homework assignment, a second homework assignment, you do that midterm exam, you write that paper, and that one thing doesn't really move the needle that much, does it, when it comes to, getting your degree? But each of those assignments and tests and papers is one more penny in the piggy bank. And if you just keep at it, you know that eventually you will get that degree at the end. But it is going to take a lot of work and some time. So that's an example of pulling from somebody's existing experiences and story as a metaphor. It's the least floofy of all the options. Floofy, woo-woo, imaginary, that sort of thing. And extending the same concept a little further, another type of metaphor that I like to use is pulling from deep in the client's past, like maybe from childhood, and reminding them of a childhood experience to apply it in some relevant way today to increase their understanding or increase their motivation, that sort of thing. And for folks who are especially like closed off and not particularly leaning into like sharing of themselves, then I might pull from metaphors that on average are a little bit more universal. So for example, if let's say we're working through something in counseling that is particularly challenging, then I might acknowledge a more universal metaphor such as, for a lot of clients, this part of therapy can feel a whole lot like going to the dentist. I don't know about you, but I don't super love going to the dentist. I find it uncomfortable. But most of us still end up going to the dentist, even though while we're sitting in their chair, we're uncomfortable. We don't have to like it. But we know that if we go ahead and do it, we're going to be better off in the long run for it. And so we're able to say yes to doing it, knowing it'll end eventually and we can move on. For some reason, the dentist one seems to be the most universal one that I've found so far, where almost everyone goes like, "Oh yeah, I hate going to the dentist." There might be a list of others, but that tends to be effective for people who are really closed off and not necessarily willing to talk about themselves, or a metaphor about their past might just be triggering. So we can pull from like things that happen for other people. Another type of metaphor is like therapeutic metaphors that are used more broadly, like the leaves on the stream exercise that I referenced before, mindfulness practices, or there's any number of ways. You're doing a deep breathing exercise and you might say something like, imagine that your stomach is a balloon that's filling with air and you're filling it until it's full. And then as you exhale, imagine that balloon is shrinking until all of the air leaves the balloon. Like that's using metaphor in therapy. So there's a lot of these metaphors that just sort of travel amongst therapists. You can find them online. We share them amongst ourselves and utilize them with our clients. Now, the next type of metaphor that at least I utilize in counseling is my favorite. It is the type that I use the least often because it's particularly special. I don't know how to describe it in like a sentence, so I'll just describe it in a paragraph. But essentially, there is a type of metaphor that will develop slowly over time for me as I work with clients, usually like over sessions. Sometimes it could happen in a single session, but there's a type of metaphor where as I'm hearing from my client and as we're interacting, we're building trust, I'm getting more puzzle pieces about their experience and their story and their stuck point and how they feel. Sometimes in my own imagination, I will start to see an image, like an actual picture in my mind that I'm thinking about as they tell their story or they're sorting through their stuck points or whatever is coming up for them. And if I keep seeing the same picture start to pop up whenever we're interacting around a certain topic or a certain stuck point, And especially if like more puzzle pieces come in and keep filling out the picture in more detail, then I might consider disclosing that metaphor to my clients. And I want to be clear, I don't try to make an image happen like I need to come up with a metaphor, Marie, come on, hurry up quick, get your metaphor in order. But I also don't squelch these images when they come. I treat them gently and with curiosity. I see them as my mind's way of trying to make sense of all these different variables that my client is describing. I think this is particularly useful if a situation feels complicated or nuanced, difficult to comprehend. If there's a lot of moving parts at play that it feels overwhelming, then I think my mind likes to create a picture to try to make it all make sense in one image. I won't share an example that I've come up with for any of my clients because it still feels very personal, even though it's a picture and not my client's personal info. So I'll share an image that I have been seeing in my mind for myself and my own experience more and more recently. So I've mentioned this at times that I am unpacking a former church experience that I was a part of. I used to be on staff at a church that now it's coming out that there are criminal allegations affiliated with that church with a person that I raised red flags about to my boss. And now, almost 10 years later, I'm unpacking more and more and more of this and going, oh my goodness, that was a very harmful situation that I was in, like beyond what I already had thought. And just over the last couple months or so, there's this image that I keep seeing, and I don't know if I've heard somebody else describe this image before. Like maybe this is in a textbook somewhere and I forgot that I read it and then it got stored away and now it's reemerging, or if my mind genuinely created this image. But I'll describe the image that I've developed just to kind of paint a picture of like how it's capturing a lot of moving parts. So the picture that I'm seeing is me coming into this church context, like treading water a bit frantically, like worried I'm going to drown. And initially seeing the church as, coming into that picture, giving me some snorkel gear, maybe giving me some little, flippers, swim fins, maybe some floaty devices. And so then my experience is, oh my goodness, thank you so much. Like I was about to drown and you gave me all these life-saving tools. I am so grateful. But now, over time, this image is zooming out further and I can see more of the picture where, yes, I am treading water and with one hand, the church is giving me all of these life-supporting devices. But now that I see the whole picture zoomed out, with the other hand, they are pushing my back down underwater. And now that I've left the church, I realize it wasn't that I was treading water and drowning without the church and they rescued me. It's that the church made me believe that I was drowning without them. And so then I became grateful and dependent on them for then also giving me all of these life-sustaining devices. But without the church, I'm a great swimmer. I can get in and out of the water as I choose. And I feel free. So that image is a way that I've kind of conceptualized my experience, because otherwise it can feel like, how did I manage to fall for this load of crap for so long? And if I put it in the context of that image, then I can have so much more self-compassion and say, Marie, like you were making sense of it with the information that you had. What you could see in the picture at that time was, I'm drowning and this church is offering me rescue support and I so appreciate it. And now I see more and I'm responding accordingly based on the information that I have now. And I can feel grateful that I was able to access and see and respond to that information in appropriate ways. I know that was a really personal story. And if you've ever been through any kind of similar dynamics, I know this was a church, but abuse looks similar in, harmful relationships and, parent-child harmful relationships, workplace relationships. It's the same dynamic, honestly. So if you feel like you can connect with that dynamic and it was heavy, I see you. And I hope that picture offers some validation though, of just like what it feels like to be in that state. Anywho, That was a long-winded personal story describing this kind of imagery. And as you can hear from me telling that whole story, usually this type of metaphor takes me a little while to describe to my clients. When I have a picture like this emerge and it sort of fills in more and more as I hear their stories, I might say something like, as we've been talking about this, there's just been this picture that's been coming together in my mind. And as we get more and more information, it's like more and more puzzle pieces filling in the details of this picture. I wonder if I can share that picture with you and we can kind of see if it feels like it captures some of what's coming up for you. Would that be all right if I shared it with you? And then it might actually take me a little while to explain it, just like I explained that picture a moment ago about my own experience. If it lands for a client, this type of metaphor has the capacity to have sticking power. Like the next time then that the client is going through something challenging, let's say if it's me in my shoes, the next time I learn some egregious behavior that my former church was up to, I can put it back into this image and say, yeah, that checks out though. That fits right in that same dynamic. Or if it's new and it changes the dynamic, then okay, do I need to change the picture a little bit to capture this new piece of information? But it feels less overwhelming because now it's just one picture. So if you can capture a client's experience in an image like this, it can be a tool that then they turn to and say, oh, right, here's that picture. Here it is happening right now in front of me, or I'm remembering this part of my story. Yep, that fits in the picture as well. And it offers a sense of clarity, an opportunity for closure, an opportunity for empowerment. For me, it's like, okay, well, if I want to get out of the pool, I'm just going to get out of the pool. We don't need to do this anymore. Okay, switching gears, because that one was like, I felt it. I shared some of my story. Thanks for listening. On a much more lighthearted note, usually. Another type of metaphor that I like to utilize with clients is anywhere that I see symbolic imagery in media. The media could be, books, movies, songs, shows, especially if there's a type of media that I know that my client is particularly into. And if it's something I'm familiar enough with that I can draw some metaphors from, I might say something like, oh, I wonder if what you're describing feels similar to what happened in such and such movie. Like, is it kind of like in The Matrix when you feel caught deciding between the red pill and the blue pill, and neither you wish you didn't have to choose any of these options, but here you are. If I'm pulling in a metaphor from media like this, I might say something like, oh, I'm wondering if this feels similar to ... or I'm reminded of that scene from ... and just kind of pitch it really gently like that. Just in case I'm way off base, then there's enough space for them to sort of go like, it's not quite like that, but maybe it's a little more like this. And then we can sort of collaborate together on fixing it up to represent whatever's coming up. And as I mentioned, most of the metaphors that I'm talking about for the purposes of this episode are therapist-generated metaphors. But from time to time, I will invite a client to name a metaphor. Now, since I'm not versed in specific metaphor-based training, metaphor therapy, I tend to do it in a more prompted, kind of closed-ended way because I'm not versed in other tools out there on inviting your client to generate the metaphor. So if I'm inviting a client-generated metaphor, it might look more like, okay, if this situation were a color, what color would it be? Or if that person were an animal in that moment, what animal would you choose to describe them? Right? So I'm giving them sort of a platform to choose a metaphor from within, rather than saying like, can you come up with an image that describes what that felt like? And for most folks, it's like, there are clients who can hang with that for sure, but that's not the average person. It can be really interesting. Even if it feels a little uncomfortable for your client, it's like a stretch that most people are able to make. Okay, I think we covered the majority of types of metaphors that I like to use with my clients, and hopefully this came through in my descriptions, but it feels important to name it explicitly that anytime I use a metaphor, I never come from a position of knowing, but from a position of curiosity and being really gentle about it. Just saying, hey, I'm really wondering, can I check in with you? I'm curious, does this fit with your experience? Or, I'm reminded of, and I never present it like your experience is this fill in the blank metaphor. It's always kind of an exploratory collaborative, curious, gentle approach. Well, this is a fun one for me. As I mentioned, I'm not an expert in using metaphors in therapy, but I certainly use them often in my practice and I find them quite useful. What I will do is I'll link below to a few more resources on using metaphors in therapy. And I'm curious, for any of you who use metaphors in therapy, like chime in the comments and share about how you utilize them, or if you have any favorite resources that you learned from, feel free to share those as well. And before we close, I'd like to thank TherapyNotes.com for sponsoring this video. TherapyNotes helps with all of your practice management related needs, from scheduling, notes, billing, a HIPAA-secure telehealth platform included, and a whole suite of AI tools to streamline your documentation process. If you'd like to check out TherapyNotes, you can get 2 months to try it for free with no commitment just by clicking the link in the description of this video. Well, thanks again for joining me in this a little bit more like casual, I think, chit-chatty episode where I'm just sharing how I use some of these metaphorical tools, and I hope you found it helpful. And thanks for being here. And until next time, from one therapist to another, I wish you well.